Nearly 39,000 British Columbians will soon be informed that their health records were compromised. 7 people lost their jobs with the health ministry late last year, accused of conflict of interest and mishandling of government data. Today, the health minister provided new details about exactly what happened. CTV's Stephen Andrew reports.
The health minister says in the next few days, more than 38,000 people in BC will receive letters saying their personal information was shared with a researcher without permission.
The file included personal health numbers, gender, dates of birth, and postal codes. The data also included information about hospital admissions and discharges, as well as medication history and medical service plan claims.
That data was linked with information provided by Stats Canada. The forms didn't include names, but they did include the mental, sexual, and physical health of the people who filled out census forms. It also included information on their lifestyle and use of health services. It's just one of 3 breaches dating back to October 2010. One case includes personal information on millions of patients. The health minister is saying little about how the files were accessed, except the information was placed on USB sticks and passed on to researchers without authorization, and the ministry wants it back.
Once that health data has left the ministry on a USB stick that is not encrypted and it's out there and someone could copy it, you are quite right. And I don't know whether that has happened.
MacDiarmid says there are more breaches, but for the meantime, details on them are being kept under wraps. The health ministry says its investigation into the privacy breaches continues, but appears to suggest there is no cause for concern.
I want to be very clear, there is no evidence. We have not found any evidence that any of this data has been used for anything other than health research.
So far, the ministry has fired 7 employees over the data breach and conflict allegations. 2 are suing the government for defamation and wrongful dismissal. Another was found dead in his home last week. The cause is still under investigation. The health minister is standing behind the decision to fire those employees. Stephen Andrew, CTV News, Victoria.